Australia has increasing levels of chronic disease like obesity and heart disease, as well as an ageing population. There's a major push to prevent chronic diseases before they happen, and the work of dietitians plays a key role in this battle. Dietitians are highly qualified health professionals who apply their skills and knowledge of human nutrition to help treat people with medical conditions and promote healthy dietary choices in the community.
I'm currently in the position of a clinical dietitian, and at the PA that involves me seeing both inpatients and outpatients. So that may be changing their menu code, offering additional menu items, and in some cases providing dietary supplements in the form of enteral or parental nutrition. In an outpatient setting, we also perform nutrition assessments and prescription, but a huge part of the outpatient setting is nutrition education and often group educations. The average day of a dietitian would involve attending ward meetings, so interacting with other allied health doctors and nurses and discussing plans and potential discharges of patients, also seeing individual patients one-on-one and organising their nutrition supplements and prescription.
An average day for me is just seeing some patients down in radiation oncology clinic, which is the workload that I've got, and just giving them some nutrition advice on how they can increase the amount that they're eating and maintain their weight. And also I attend multidisciplinary meetings. And that involves the doctor and nurse and other allied health professionals, just to have a bit of a feedback session about the patients and to pick up any issues, any new patients that I may need to see. I also do some project work and some quality activities in between when I'm not seeing patients.
The most rewarding part of my job is being able to help people see their nutrition status improve and also impacting their clinical outcomes, and knowing that we've played a big part in that. Also, I very much enjoy the variety, so when I undertook the dietetics course, I didn't realise at the time the variety of work which I could potentially work in, and I think the huge patient contact and the interaction with other staff members as well.
I know it's very cliche, but I enjoy helping people and talking with patients, the interaction between not only patients but with other professionals as well.
This degree is different in that it's a Master of Dietetics. Therefore, it's not a Master of Nutrition and Dietetics, so candidates for entry have to have completed a nutrition degree. And so they need really to have done the Bachelor of Health Science with a nutrition major or its equivalent. They need to have studied biochemistry, at least to the second year level of science, and physiology and nutrition science and some food science. They need to have completed immunisation and blue cards as well, because it's in the healthcare system. So it's quite a battery of it, and that allows us to commence their practice immediately in week 1. This allows people to be recognised as a dietitian, and what that does is it allows entrance into some of the Medicare benefits. So students, graduates, can work in a public or private healthcare system. They can work in business for themselves. They can work within the food industry, advising on labelling and legislative requirements. So there's a variety of options like that, but it is in both the public and private sector. Well, I think for people who want to get into the dietetics profession, this is a really good option, and I think it should be the preferred option because it is both more directed at dietetics and it is more practical and it is an accelerated learning program. It's innovative and will be the first of its type in this format in Australia. Theory and prac is taught together. So students will be practicing in the healthcare system the skills and knowledge they have learned in the theory program at the same time. And that's what's new about this. So rather than the traditional method of studying theory first, then doing the practice, it's being run concurrently. And we know that will give better learning outcomes. It covers the 3 compulsory domains of dietetics, which is medical nutrition therapy, public health and community nutrition, and food and service management. So students will learn all of those three, plus counselling, evidence-based practice, and there's some elective pracs in rural health, for example, mental health or paediatrics.
Dietitians work in a wide range of settings, from patient care, community nutrition and public health, to the food industry or research facilities. The profession will play a key role in the battle against the rising tide of chronic disease. The Masters of Dietetic Studies, with its emphasis on industry experience, ensures graduates are job ready to play their part. To find out more about studying health at UQ, visit UQ's study website, uq.edu.au/study, and click on Health.